Hello, everyone, and welcome to our Lunch Bites webinar series. See, everyone's computers are coming online right now, so we're just going to wait a moment before we get started. Okay, thanks for joining us today. Our Lunch Bites webinar series is held at noon Central Time on the second Tuesday of every month. Each webinar in our series features a 20-minute presentation followed by a short Q&A session. Feel free to ask questions as you think of them during today's webinar by typing them into the chat window on your webinar control panel. All of our webinars are archived on our website, farm2school.org, which is where you'll also find additional resources related to Farm to School, including links to Farm to School contacts in all 50 states. If you're new to Farm to School or have questions about food safety issues, local policy, or other general questions, please contact your state lead after today's webinar. While you're on our website, you can also sign up for our email newsletters, which will let you know more about future webinars. We do have our next webinar scheduled. It will be on April 9th on the topic of locally sourced beef in school meals, strategies for success. Today's webinar is titled Child Nutrition Reauthorization 2015, Time to Start the Conversation. And I'm very pleased to invite to introduce our panelists today. As I said, I'm Chelsea Simpson, and I'm the Membership and Communications Associate with the National Farm to School Network. I'll be hosting the webinar today. But we also have with us Jan Poppendich, who is a Professor Emerita of Sociology at Hunter College and the Director of Public Policy at the New York City Food Policy Center at Hunter College. Actually, I said that wrong. I skipped one. I apologize, Jan. Her primary concerns, both as a scholar and as an activist, are poverty, hunger, and food assistance in the United States. She's the author of several important books related to food policy in America, including Free for All, Fixing School Food in America, which received the 2010 Book of the Year Award from the Association for the Study of Food and Society. We also have Maureen Spill on the line. She's a Senior Associate of Research on the Kids Safe and Healthful Food Systems team, a joint collaboration with the Pew Charitable Trust and Robert Wood Johnson Foundation. She's been on the team for a year and a half. Before that, Maureen completed her PhD in Nutritional Sciences from Penn State and has a degree in food science and worked as a researcher in the food industry for more than 5 years. I'm going to go ahead and give the mic over to Jan now.
Okay, well, I'm pleased to be here and welcome to all of you. Every 5 years or thereabouts, Congress reauthorizes all the federal school meal and child nutrition programs. When I say thereabouts, sometimes they give themselves an extension. But the current law expires at the end of September 2015, and so probably sometime in 2014, they will begin working toward a new reauthorization. These programs are, in fact, permanently authorized, but the periodic reauthorization process provides an opportunity to adjust them, to change circumstances, to improve them, and this system of periodic reauthorization also helps Congress manage its workload. Chelsea, I'm not seeing a way to move the slides forward. Aha, thank you very much. Reauthorization includes all of the programs, Child Nutrition Reauthorization, CNR for short, all of the programs that you see on this list. You can keep track of them by thinking of them in 3 categories. There are the school food programs, so that's the school lunch and breakfast programs, the special milk program, and the fresh fruit and vegetable program. There are the out-of-school time programs. That's summer meals and after-school meals. And then there are the early childhood programs, the Child and Adult Care Feeding Program, the WIC program, and the WIC Farmers Market program. Now, this is a long list, and you could be looking at that list and thinking, oh, what if my favorite program gets lost? You know, what if there's not time for enough attention to farm to school within all of this? So I want to reassure you that there are enormous advantages to advocates of having all of these programs reauthorized in one package. I was going to read you a long excerpt from an interview I did, but I think in the interest of time, I'm just going to summarize it. This was an interview I did with Ellen Teller, who is FRAC's chief lobbyist, right after the 2004 Child Nutrition Reauthorization. And that was a reauthorization that surprised everyone who was working in the field with how much good stuff advocates and their allies in Congress were able to secure, because otherwise that was a period, it was a very kind of toxic environment. And so I asked Ellen how they did it. And basically she said that they agreed early on a set of principles, very broad, very general principles: feed more kids, simplify paperwork. And then they went out and built, as she said, the largest coalition she had ever had an opportunity to be involved with. And it had all the usual suspects: the Washington-based advocacy organizations and the religious organizations and the direct service providers. And then had the education groups like the Association of School Administrators, and it had medical and health groups. And went on down the list. But the part that interested me the most was that they also attracted a lot of groups for which food is not their central concern. These are the Police Athletic League, or the American Lung Association, that's primarily interested in smoking cessation among teenagers, or groups that were working to prevent teen pregnancy. But what they had in common is that they all understood that having good programming for young people in the after-school, out-of-school time hours, after school and during the summer, would help them to achieve their programmatic goals, and that the food that is provided through the programs we work on is the carrot that gets the kids through the door, is the lure. So I want to encourage you not only to begin early to agree on what the overarching principles are, but also to think broadly of what are the groups that might benefit, whose work might be enhanced if we were to win our demands, as it were, in the next round of child nutrition reauthorization. Congress can use other vehicles. They are not limited to using the reauthorization to make changes in these programs. They can make changes in any of these programs during the Farm Bill, in appropriations and budget reconciliation processes, pretty much in anything they please. And the Fresh Fruit and Vegetable Program is a really good example of this, because it was started in a Farm Bill in 2002 as a very small pilot. And in 2004, in CNR, Child Nutrition Reauthorization, the pilot was extended to more states. And in 2006, in an ag appropriation bill, it was made permanent and more states were added. And then in 2008, in an omnibus spending bill, it was extended so that it's available to all states and territories. And again in 2008, in the Farm Bill, it was retargeted a bit. So that's an example of Congress using CNR and a bunch of other vehicles to make their changes. I was asked to provide a little bit of historical background, and I thought what I'd do is just a couple of highlights from earlier CNRs. In 1989, the Child Nutrition Reauthorization included pilots to test alternatives to the daily meal counts. In other words, they authorized experimentation to try to find alternatives to the very burdensome accounting requirements that school food service faces. In 1994, that's when the Child Nutrition Reauthorization required school meals to comply with the Dietary Guidelines for Americans. So that was called the Healthy Meals for Healthy Americans Act. 4 years later, after-school snacks were authorized. In 2004, in the CNR that I mentioned, that was a very hotly contested one, advocates and their allies in Congress were successful in fighting off a threat that went by the name of over-certification. The George W. Bush administration had charged that that there were more children receiving free and reduced price meals than there were poor children in the United States, according to census figures. And advocates did their homework and their analysis and were able to show that that's because the census figures used annual income, and certification for school food is based on monthly income, and people are much more likely to be poor in any given month than to be poor for the entire year. But the good news is that growing out of this closer look at income dynamics, a great simplification was added to the school food programs, so that now once a child is certified as eligible for free or reduced price, that certification holds all year, and parents are no longer expected to report fluctuations in their income. This also had the effect of reducing the error rate, because if you don't have to recertify children every time their parents' income changes $50, why then you're reducing the opportunities for error. Because 2004 was regarded widely as a victory in an unexpected context, I thought I'd just summarize the lessons from 2004. And the first was advanced planning. I think I may have overstated it here when I said 3 to 4 years, but they began 2 years in advance of when they expected CNR to be, but then it was deferred a year, as it often is, and so they ended up with 3 years of lead time, which they found very helpful, because by that time they'd done the work and made the case and participated in congressional hearings to argue for the substance of changes that advocates were seeking. And so then they had the extra year to go to the budget committees and try to get more money for child nutrition programs, which would make it possible to implement these improvements if they could get them through. I mentioned the agreement on broad principles, and we want to make sure that we get in on that process of establishing what the broad principles are. In 2004, they were very careful to key those to congressional themes, to things they knew were the interest of Congress. So education, test scores, they took congressmen out to see after-school book clubs with meals, with snacks, where kids were improving their literacy, learning to love books as well as learning to read. Childhood obesity was another, and they showed that the summer meals programs and the after-school meals programs not only provided healthy food, but also engaged kids in healthy activity. The whole issue of safe havens for children whose parents are at work, and as I mentioned, the food is the carrot that often gets kids in the door to these programs. I mentioned the extensiveness of the coalition. I also learned from looking back over this history how frequently the pilot program strategy has worked. I have been a pilot program skeptic because sometimes it seems like real tokenism to me. But I have to say I'm convinced, looking at what's happened with what are called the Lugar pilots that simplify accounting procedures in the summer meals program, and certainly with the fruit and vegetable pilots, that these programs really have grown and expanded once the precedent was established. I was struck by Ellen's comments about the importance of face-to-face meetings in this process. She said to me, well, if you sit down with a Hill staffer over a cup of coffee, the meeting will last longer. It will last at least until you finish that cup of coffee, and I've learned how to drink ice-cold coffee if need be. I think we want to plan for as much face-to-face interaction with members of Congress as we can muster as we get closer to the child nutrition reauthorization itself. So that concludes my little lecture.
Thank you so much, Jan. And I'm going to give the keep the controls over to Maureen now.
Hello. Sorry, I'm just trying to figure out how this works. Thank you for having me today. I'm really excited to be here. Many of you may know my colleague, Megan Lott. She was actually originally supposed to be giving this presentation, so I'm filling in for her, and I can only hope that I'm half as good as she is at this. So I'll do my best. Jan, great introduction. And so we'll start where you left off after the 2004 reauthorization. The next big reauthorization was the passage of the Healthy Hunger-Free Kids Act that was passed in December of 2010. This brought a huge investment of $4.5 billion This is particularly large when you consider that in 2004, they authorized $487 million. So in 2010, we got almost 10 times as much money. And this money, it was largely overdue. The Healthy Hunger-Free Kids Act was the first real improvement to child nutrition programs in more than 15 years. The Healthy Hunger-Free Kids Act gave USDA the authority to upgrade nutrition guidelines for all foods sold in schools throughout the entire school day. It allowed for improved program access and improved program operation and accountability. So where does the Farm to School program fit into all of this? And if we can switch the slides, I'm not sure mine is working. There we go. Okay. Oh, now I'm not sure. Okay. So the Farm to School Grants program was a key provision of the 2010 Healthy Hunger-Free Kids Act and created funding for this program. You can find more information on the provision at the USDA's Farm to School website. The grant program provides $5 million a year in mandatory funding for a Farm to School competitive grant program. And these funds support a wide range of activities from planning, training, and developing partnerships to purchasing the equipment that's needed, planting school gardens, organizing field trips, and grantees can include anything from the schools and the districts themselves to Indian tribal organizations, producers, producer groups, nonprofit entities, and state and local agencies. So really, they're open to a broad range of stakeholders. USDA estimated that schools would incur an additional 12% increase in costs to meet the updated school meal nutrition standards. This equates to $6.8 billion, so $4.2 billion for breakfast and $2.6 billion for lunch. And despite what many people say, this was not an unfunded mandate. The rule included specific sections that outlined how revenue would be generated to support serving the healthier meals outlined in the Healthy Hunger-Free Kids Act. First, in Section 201, an additional 6 cents was allocated to reimbursable meals meeting the updated nutrition standards. Secondly, it was found that many schools hadn't increased the price of their meals for years despite increase in costs. This resulted in schools charging less than the cost to produce the meal, even when factoring in what the government was subsidizing for the meal. This meant that schools were losing money on every full-price lunch that was purchased and were supplementing these costs from reimbursement for free and reduced price lunches. Section 205 of the rule requires school districts to establish a price for paid lunches that is, on average, equal to the reimbursement the school district receives from the federal government for each free lunch it provides. School districts must either gradually adjust the price they charge to students or provide additional non-federal funding, for example, by contributing additional state or local funds. The maximum required price increase per year was 10 cents. And this would result in a larger budget for providing healthier school meals to all students. Additionally, USDA found that the average school district is losing money on competitive foods. In fact, revenues from competitive foods fell short of the cost of producing them by an average of 29%. As a result, federal funds from the school meal program, which are again intended to offset the cost of lunch for the low-income students, were diverted to help pay the cost of producing a la carte and other items sold outside of the meals program. So, Section 206 of the Healthy Hunger-Free Kids Act requires that all competitive foods purchased through the school food service budget and sold in schools must generate revenue at least equal to their cost. In other words, they must break even. The objective is to eliminate the practice of using federal funds intended for meals to subsidize competitive foods. This new pricing rule will give schools the ability to generate an important source of non-federal revenue, $7.5 billion over 5 years, that will sufficiently cover the cost increases of the healthier meals. USDA projects that price equity will result in higher revenues from competitive foods. It will also lead to more students participating in the school meals program, which will increase the amount of federal reimbursements and help ensure more children are receiving healthy meals. So that was the last reauthorization. What's next? The current programs will expire, as Jan mentioned, September 30th, 2015. So the next reauthorization should be completed by then. It is likely that the relevant committees will begin holding hearings and then move to drafting the bill in 2014. The relevant committees are Ed and Workforce in the House and Agriculture in the Senate. About 18 months before the programs expire, coalitions will begin to convene. They'll start to set their priorities and hold meetings on the topic. Two important coalitions to note here are the Child Nutrition Forum and the NANA Coalition, NANA being the National Alliance for Nutrition and Physical Activity. The Child Nutrition Forum, which comes together for CNR, is made up of primarily anti-hunger groups and is convened by FRAC. The NANA Coalition, which is primarily composed of nutrition and public health groups, will begin to discuss the next CNR soon. So if you're interested in joining these conversations, it is good to come with an idea of what you like from the CNR 2015. As Jan mentioned, it's important to go into it with clear asks. And many are involved in this process. Anybody from, it goes from Congress, USDA, state agencies and local schools, school districts, nutrition, public health, anti-hunger and poverty advocates, the food and beverage industry get involved, and of course trade associations such as the School Nutrition Association and union labor. So this is what I've prepared. I'm hoping that this will give you a sense of what recently happened with the Healthy Hunger-Free Kids Act and how you can start to look forward to getting involved with the CNR 2015.
Thank you, Maureen, and thank you again, Jan, for your great presentations. We will open it up to questions now. We always get the question of whether or not this webinar is being archived, and it is. Both the recording and the slides will be available on our website in about a week. And if you register for the webinar, you will get an email when those are available. So I will go ahead and open it up to questions now. Just looking through here. One question for you, Mary. We also have a couple other people on the line to answer questions today who weren't presenters. We have Mary Stein from the National Farm to School Network, and if needed, we also have Helen DeBallis from INSAC. Mary, we have a question here about what the National Farm to School Network, if they have developed, if we've developed policies and priorities yet regarding Syria, and what our next steps are as an organization.
Great, I'm happy to answer that. Chelsea, can you hear me okay?
You sound
Yes.
great.
Okay, great. So the National Farm to School Network is just beginning our process for gathering input and conducting listening sessions to inform our strategies and our approach towards child nutrition reauthorization. We are bringing on a policy director who will be starting on March 25th, and I'm happy to announce that that's Helen DeBallis, who is on the call as well. So Helen will be joining the network and leading our policy initiatives within the National Farm to School Network. Very early on in her position with the network, she will be developing a plan for specifically for CNR 2015 and our engagement around promoting farm to school and local food systems initiatives within CNR 2015. So look forward to hearing from Helen and other network staff as we move forward into this spring.
Another question here: is it typical for the for this to be delayed? What's the probability that this will take place in 2015 and not sooner or later? Is there any chance it would be sooner, or is it always something that happens at that time or later?
It's highly unlikely to be done sooner. I can't think of any examples when they decided to take it up a year in advance. My informal observation is that when it's done later, it's usually been that they started in time to get it, you know, they were expecting to do it in the designated year, but that the process was slowed down. There were deep conflicts that couldn't be resolved. There was too much other congressional business, and they carried it over. They certainly have the option to give themselves a one-year continuing resolution and just start later, but that's not how I think it has usually happened.
Great, thanks, Jan. And so here's another question. So is the Healthy Hunger-Free Kids Act part of CRN?
It's CNR.
Sorry, that was me. I said it backwards. CNR.
Yeah. Right. It was the Child Nutrition Reauthorization for that year. Each of these actually has a name. The Healthy Meals for Healthy Americans Act. I mean, they always will have a name, but people will remember them mostly as CNR 2004 or CNR 2010.
So they're basically one and the same. It was just what it was named that year. Okay.
Yep.
That makes sense. I'm actually, speaking of acronyms, I think that I'm going to go back a slide or two, just in case there's anybody listening today that is really new to this process. I think that we mentioned NANA. There were a few acronyms on this slide. I wonder if somebody might want to de-acronym some of these organizations for us. I think FRAC was mentioned, and NANA. What do those acronyms stand for?
Well, FRAC is the Food Research and Action Center, and NANA is the National Alliance for Nutrition and Physical Activity.
Great, thanks.
And CNR is Child Nutrition Reauthorization.
Thanks, Jan. Well, I'm not seeing any other questions here at the moment. I'll give everybody one more chance if you have a question that you would like the panelists to answer today. If you think of something later, feel free to email me. My address is here on the screen, and I can direct your question to our panelists today. I want to thank everyone again for joining us, and especially Jan and Maureen for being on the call and making time to give their presentations today. And again, we hope to see you on our future webinars. Thanks. Have a great day.
Thank you.